Hi, I'm Jim, N4BFR. Here is your COVID-19 update for Georgia. We'll take a look at the metrics from July 31st, 2020, the last day of July, and it's been a heck of a month, so let's get into that and talk about those those numbers and how we've changed over the month. Let's start with testing. Testing was a good day today. We had over 33,000 viral tests, which is definitely where we need to be. We still need that additional 10,000 capacity that the governor's been talking about to really complete the ramp up. But when you compare it back to the first of the month when we were only doing 16,000 tests a day, we've very nearly doubled our number of tests. Now, the testing throughput still isn't there. It takes 4 days to get a test into Cobb County and 3 to 5 days to get the results. So I think we've still got a ways to go before this can really start to catch up with the contact tracers. But I'll give credit where credit's due. We've doubled up the number of tests this month. Unfortunately, we've doubled up the number of cases. We've actually gone more than double. Our case volume was 2,100 cases a day on average for the 7-day average as of July 1st. Today we passed 4,000 again. We are averaging 3,500 cases a day. Some of that is pulled down because of the weekends, and we don't get the analysis completed through the weekends that we'd like to see. So that could very easily be 4,000 or more. But 4,000 is where we are at today. Our testing volume, as I talked about, improved. The average positive test rate is now at 13%, which is right around where it was at the beginning of the month. So we kind of stayed on par. However, you see that we're up to almost 16% mid-month. Really kind of straining at wanting to get more capacity there. The scientists say that should be about 5% in order to be able to keep up with the contact tracing and reduce the volume overall. So we've got a ways to go on that. But at least right now we're seeing fewer positives, and hopefully that's a beneficial thing. Again, looking at how we've performed over the month in the state of Georgia, the really unfortunate thing is deaths, right? We started off at 17 deaths per day on average, and we were really driving that number down. So that was something that was looking good for us. Now we've come up and we've seen these last 5, 6, 8 days where we're passing 70, 50, 70, 75, 80 deaths a day. We had 81 deaths reported today. And that's unfortunate, particularly when you think about the people that are associated with that, right? It's not just a statistic. It's somebody's sister or aunt or father that's being passed along. So it really frustrates me to see some people go, well, people are going to die from something. Yeah, but this is something that if we tried a little harder, we could actually reduce this number. And it's the needless deaths that I think are the most frustrating to me. Along that lines, we have literally filled hospitals. We have put another 400 people in a hospital, say 386. We've brought our average people going into hospitals. That new hospitalization rate is at 386. I'm sorry, today's report was 386. Our average new hospitalization rate is 277. That's up from 137 at the beginning of the month. So doubled up the number of people we're trying to cram in a hospital every day, to the point where we are hearing stories like people having to wait in ambulances in order just to get into ERs. Hopefully that won't continue to be the case with the 60 new beds that are coming online on Monday in Atlanta, but I'm not hearing that Atlanta's the worst of it. So I'm hoping for places like Athens and Milledgeville and Tifton that we're getting them the help there too. And hopefully we'll be able to hear some of that as we go forward. we, from a number of people in the hospital today standpoint, we are at 3,155. And what does that mean? That it means that we have put twice as much volume into hospitals in the last 31 days than we had in June. And that's a lot of work for a lot of nurses, a lot of doctors, a lot of physician's assistants, a lot of even down to, catering and janitorial and just everybody that works around the hospital. It's a ton of pressure right now. And, if we're not doing the right thing and all the things we could be doing and trusting people to do the right thing and not seeing them do it, then I think we need to think about redoubling our efforts on wearing masks and maybe even let's go out on a limb and go on with the 20 other states that have started to require masks. Because yes, it should be optional, but enough people are not doing it that we're spreading this disease. My opinion, we welcome yours. YouTube is free. Go ahead, post whatever you want. I'll be glad to watch your opinion as well. And we'll see where we go from there. All right. Last thing I want to touch on is I'll touch on a couple of more things. First of all, let's look at the RT trend. RT trend, that is the relative transmission rate. And what that tells us is if that number is at 1, that means for every one person with COVID, they're passing it on to an average one other person. We've now slipped down to 0.95, which means a little less than one person is passing it on to one person. That's going to hopefully at least keep us on par with the number of cases, the number of hospitalizations we've been seeing. I think it would be a lot of pressure to see what would happen if this number continued to go up from an RT perspective. Jump into the CCU report real quick. The good news here is that while we have the same pressure points that we've had in region E and F, H, L, and region N, those haven't changed, but we have seen some of this lighten up a little bit. We're down about a point overall in total statewide availability. We've got 410 beds available now. A few beds came online this week, but I'm thinking it looks more like discharging, but I'm hoping, really hoping that these areas are getting help because it has been just a real hurting time for them. So my heart's going out to those folks in those areas right now. So let me summarize a little bit with what we've seen this month. Testing improved, but it really needed to improve because we had a heck of a spike in cases. 105,000 new cases this month. That's more than we've had all the rest of the pandemic. We came into July with 81,000 cases in Georgia. We're leaving July with almost 190,000 cases. So we've had a lot of sick people in our state this month. We've lost a lot of people this month. We have had over 900 deaths this month. And some of this is preventable. So as I said earlier, it bugs me to hear people say, oh, well, people are going to die anyway. Put on a mask and then let's see what happens in a month. That's really where I leave it at that. I think this is one of the better ways to tell what the impact has been. We started the month in Georgia with the 9th most cases as a state nationwide. Given the fact that our population is 8th most, we're actually underperforming in number of cases versus the rest of the country. Now, when we end the day today and all the numbers get counted for the end of July, we will be 5th most. We're going to pass New Jersey today. When we pass New Jersey, there's really nobody else to pass. The next states that we're coming up to are 2, 3, 4 times bigger than us. Florida, New York, and Texas and California. So we can sit at 5 for a long time, and we probably will. But the fact that we blew by Indiana and New Jersey and Arizona, especially New Jersey and Arizona, places that have been really heavily impacted over the last few months, I think that should put a little worry into people's minds that we're not taking all the steps we could to really mitigate what's going on, especially when you compare it to states similar to us, like North Carolina is a great example. They're just up to the north of us, and they seem to be doing a lot better job than we are here in Georgia. I'm hoping our leaders sit down and look at what the difference is and what we could do to possibly do better in August, because we got a new month. Let's start it fresh. Wear a mask. Figure out how to help out. Let's get these deaths down. Let's get these cases down. And let's hope that we're not sitting here at the end of August talking about all the other records we've set and all the other ways that this thing has just continued to explode. So that's my hope as we go into August. I appreciate you listening to me and giving me a little bit of a forum here. If you have any questions, comments, concerns, thoughts, please jump into the Reddit discussion. I'm always link it to the bottom of the post. So you can join in with us. It's the Coronavirus GA subreddit, and it'd be great to have your feedback there. In the meantime, hope everybody stays safe, stays out of trouble, and I'll be back with an update on August 1st, and we'll talk about how we're doing for the new month. Thanks.